everyone, I'm Ryan and I am presenting today on my topic, excessive gestational weight gain, a rising concern for generations to come. So let's start with the US epidemiology. For this topic, I do think it's important to also discuss weight before pregnancy because this is an issue and does seem to play a role in the amount of weight gain during pregnancy. So for some statistics, 1 in 2 women of childbearing age are overweight or obese. 47.2% of women gained excessive weight during pregnancy. And then, according to the CDC, 48% of women are gaining too much weight during pregnancy, which is the most up to date statistic. Then, lastly, overweight and obese women had the highest prevalence of excessive gestational weight gain at 64.1% and 63.5%, which is why I mentioned that pre pregnancy weight is also important. There is no data that directly links excessive gestational weight gain to infant or maternal mortality, but as we will discuss later, excessive gestational weight gain can lead to certain complications that do increase the risk of mortality. Interesting, while pre-pregnancy overweight and obesity in the US are the highest compared to Europe and Asia, many other countries are also experiencing high rates of gestational weight gain. So to look at the local epidemiology, here are 4 statistics. 23.8% of women in San Diego County entered pregnancy overweight and 17.6% obese in San Diego. 35.7% of women gained excessive weight during their pregnancy in San Diego. The bottom 2 statistics are just California in general. So from the CDC, the prevalence of pre-pregnancy BMI in the overweight and obesity categories in 2015 in California were 26.4% and 23.3%. And also in California, the prevalence of excessive gestational weight gain was 44.4%. So again, there's no data on mortality rates, specifically from gestational weight gain, but there is data on mortality from pregnancy complications that may be related to weight gain. So the mortality rate for infants related to maternal complications of pregnancy was 58.5% between 2014 and 2016. According to the County of San Diego, the rate from diseases of the circulatory system was 9.2. The rate from disorders related to short gestation and low birth weight, not elsewhere classified, was 44.3. Other interesting data, 15.7% of women in San Diego experienced food insecurity during pregnancy. And only 22.7% were uninsured prior to becoming pregnant. 2.4% were uninsured during their pregnancy. So a look at disparities, and these are the U.S. Disparities amongst the U.S. in general. So the prevalence of obesity among Black women aged 20 to 39 is twice that of white women, and Hispanic women face 1.2 times higher prevalence of obesity. So the statistics are similar as far as excessive gestational weight gain. All around 50%, essentially, besides Hispanic women, are gaining too much weight in pregnancy. Interesting, though, 6+ studies concluded that both Black and Hispanic women in general gain less weight during pregnancy. And then another interesting factor is that complications of excessive gestational weight gain are more prevalent in Black and Hispanic women. So looking at what are the underlying causes of excessive gestational weight gain. So there are many. It is a critical and sensitive period, meaning that there is a higher impact on both mom and baby's health during this time. We do have to consider everything that's occurred in the woman's reproductive years. So it's a combination of health behaviors over all of these years. We have to consider behavioral efficacy and normative beliefs. So this is what ultimately controls what activities a woman partakes in during her pregnancy that are going to affect the health of her and her baby. Also prenatal care, the initiation, when did they start going to the doctor, and the quality of their care as well. Substance abuse also plays a role, and then access to healthy food and higher priced food. So this is the ecological model, just showing you the factors at the individual level, community, and society level, then also the policy and guideline level as well. For the sake of time, I'm not going to read all through those. Then let's look at the impact. What is the impact of excessive gestational weight gain? First, mom. So there's an increased risk of complications during her delivery, possibly longer recovery time, and health implications after baby, potentially years later down the road. Of course, it impacts the infant, so increased risk for many health complications at birth and also beyond later in the child's life as well. The family is also impacted with increased medical expenses. The mom's time away from home, also increased stress. The last factor it affects is society. So again, increased medical expenses, and the mom is her decreased contribution to society. So then let's talk about the program that I researched in San Diego, which is called the Comprehensive Perinatal Services Program. It was created to reduce morbidity and mortality among low-income women and their infants in California through enhanced prenatal care. The goals of the program are to decrease the incidence of low birth weight infants, improve the outcome of every pregnancy, give every baby a healthy start in life, and lower healthcare costs by preventing catastrophic and chronic illness in infants and children. So the focus is on these three areas here, which is nutrition, psychosocial, and overall health education. So nutrition, they do an initial 1.5 hour consultation. There's about 3 to 4 meetings with a dietitian or nutritionist where they review a food diary and go over individualized nutrition education for the participant. The psychosocial piece, they do have a mental health screening and a lot of referrals. Then lastly, overall health education. Basically, these participants are receiving additional education on top of what is provided at their standard OB visits. So when I interviewed the program coordinator, Shelley, she mentioned the data on the effectiveness of the program is very old, but that the program started as a study in the 1980s, and it showed it saved a lot of money because of decreased NICU stays and other unwanted pregnancy complications. So overall, a really great program with enhanced care for these pregnant women. So looking at interventions that work, how can our public health efforts be improved to decrease excessive gestational weight gain? So two studies or interventions that I looked at were kind of like the program that I just mentioned in San Diego, individualized health and nutrition counseling. So making individualized weight recommendations per each pregnant woman, using motivational interviewing to allow the participants to set their own goals, and then also making sure to set follow-up calls with these women, check in, see how things are going. The second intervention that works is using technology, which is not surprising in the world we live in today. So this study hadn't been completed yet, and I couldn't find the rest of the study, but it looked at utilizing texting and video messaging, also using Facebook groups and online education like websites and videos for educating and things of that nature. So both of these, the first one was proven to be effective, and the second one I can almost guarantee would be effective, but the results were not in on that study. So in conclusion, obesity is at an all-time high, and therefore many more women are entering pregnancy overweight or obese. Additionally, women are gaining too much weight during pregnancy. This is a public health concern because not only does this excess weight affect them, it is also affecting a second generation. Gestational weight gain is a complex issue that is going to take a multifaceted approach to address, but a good starting point is to look at what is working from previously studied intervention. That is it. Thank you guys so much, and let me know if you do have any questions.